Welcome, welcome, welcome.
Thank you.
I can hear sounds in my downstairs. Welcome, welcome, welcome. Okay, so what happened here? I can hear sounds in my downstairs. Welcome, welcome, welcome. Chai. Okay, so what happened here? I can hear sounds in my downstairs. Welcome, welcome, welcome. Sorry about that. I needed to get the mic where it should be. Haman from London said he just finished brushing his teeth. Ready to go. So, good evening again. I'm Dr. Toyin Okwesomi, and I am a family practitioner, HIV specialist. I also treat addictions in Maryland, and eager to hear what Dr. Ajagbe has for us tonight in the microbiome sphere. We talked about, oral possible problems last week, and the issue of this microbiome came up. I also heard that some people thought I was attacking Dr. Ajagbe. I will never attack my brother. I wasn't. I just was helping him realize that though we're primary care physicians, we don't have all the answers. We don't have the ability to order any test we can, and there are certain tests that are not available to us. So I'm glad that we're continuing the conversation tonight so we can shed more light into what we need to screen for, what we can screen in the clinic, and how to take care of our oral health, because it does affect our hearts, kidneys. It affects all other systems in the body. So this is something that most people did not know. And I'm sure now that on Medical Mondays Family, we have come to that realization, but we're still learning, still a lot to learn. And I'm eager, looking forward to what Dr. Ajagbe has for us tonight. So, Dr. Ajagbe, over to you, and behave so that I don't do what I didn't do last time.
Okay, all right, I'll behave. Can you all hear me, please?
Yes, please.
Yeah. The topic, though, the topic tonight is unveiling the hidden dangers of the imbalanced oral microbiome's impact on systemic health. Well, I just want to welcome you, ladies and gentlemen, again to today's engaging lecture on the profound influence of the microbiome on our overall health. So if you notice that last week we talked about, generalization of the imbalance in the oral microbiome, but today we will delve into the risks associated with an imbalance in the oral microbiome, focusing on two of the notorious microorganisms. We call them pathogens in medicine. So the two organisms that we're going to focus on that seem to have very far-reaching impact on oral health as well as systemic health are Porphyromonas gingivalis. So you don't have to try to memorize the name. You can just say P. gingivalis. And the second one is Streptococcus mutans. You can say S. mutans. So that way it's easy for you to remember. Don't try to, if you can memorize the words, that's fine. But it's not very important to know all the spellings if you can't do it. So join me as we explore the intricate connections between oral health and systemic diseases, uncovering how Porphyromonas gingivalis is linked to various health conditions. So let's start with the understanding of the risk. We'll start with Porphyromonas gingivalis or P. gingivalis and Streptococcus mutans, S mutants. Let's look at the role of Porphyromonas gingivalis in systemic disease. The very first one that seems to be very prominent in literature and in research is the one on cardiovascular disease. So there are so many research publications to show a significant association between Porphyromonas gingivalis and an increased risk of heart disease. This microorganism, that is the presence in the periodontal pocket, I'm sure some of you know what that means. But for those who do not know what periodontal pocket means, is when the gum is swollen and is separated from the tooth surface, the space between the gum and the tooth surface is called the pocket. Usually it's supposed to be less than 3 millimeters in normal health, but in pathogenic situation, that is in diseased state, when you have somebody has a chronic gum disease, either chronic gingivitis or chronic periodontitis, the pocket can increase. In fact, sometimes it could be as far as the length of the root of the tooth, because most of the time when the bone is resorbed, it exposes the root, and the pocket against the root can be very, very detrimental. So, so when we talk about the Porphyromonas gingivalis, we are thinking about its contribution to the disease. Hold on, I'm not sure what you. Can you see me?
Yes.
Yes, sir.
Hold on one second. I got a message saying we're only seeing part of something. I'm not sure.
We see you very well.
Okay. All right.
And your purple is beautiful.
Thank you. AJ was sending me a message. I wasn't sure. I couldn't read the message while I was talking. So, all right. So, so the presence of the periodontal, the presence of the P. gingivalis in the periodontal pocket can lead to chronic inflammation, not just in the mouth, but systemically, thereby contributing to the development of atherosclerosis, potentially triggering heart attack and stroke. Okay, let's look at its effect on respiratory system. Studies have revealed that Porphyromonas gingivalis can be aspirated into the lungs. And of course, that is not too difficult to imagine when you think about people who are mouth breathers, who constantly breathe in air that is not purified, air that is not moisturized. Occasionally, saliva from the mouth can go into the airway, and when it gets into the airway, what can happen is infection, such as pneumonia, or which may eventually lead to chronic obstructive pulmonary disease, which or the COPD. So the presence of the P. gingivalis in the oral cavity can contribute to chronic inflammation, not just in the mouth, but also in the respiratory system, particularly when the immune system is not up to par.
Sir, are you sharing a slide? Are you sharing slides? Somebody was just asking.
No, not sharing it.
Okay, I didn't think so. Thank you. Sorry for the interruption.
No worries. So the next systemic condition that Porphyromonas gingivalis has impact on is rheumatoid arthritis. So most people may not know what rheumatoid arthritis is. So it's inflammation of the joint that is not as a result of aging, because rheumatoid arthritis could affect anybody at any age. So Porphyromonas gingivalis or P. gingivalis is implicated in this development and progression of the rheumatoid arthritis. There's a unique enzyme that is present in that particular microorganism that causes this problem, and it's abbreviated to PADS or PADS. It's a long name that means peptidyl arginine deaminases. So, but you don't need to remember the long name of that enzyme. That enzyme can modify proteins in the body, particularly in the joints, triggering autoimmune response and leading to joint inflammation when it takes place in the joint. So imagine somebody having chronic gum disease and not taking care of it and just assuming, oh, it will go away. Oh, that's what happened to my grandparents, and it happened to my parents, and it happens to me. So I just need to leave it alone. Well, when I lose all my teeth, so be it, because they all lost their teeth. No, they can be mitigated. They can actually be treated. So just awareness is very important in this case. Many of the patients that should never have experienced rheumatoid arthritis have become exposed to it because they have not taken good care of their oral health. All right, the next one, which is a big one and is very far-reaching, is the adverse pregnancy outcomes. So research have been, documented to show that gum disease, as caused by Porphyromonas gingivalis, has been associated with adverse pregnancy outcomes, which includes preterm birth, low birth weight, preeclampsia, and even stillbirth. So the presence of these organisms in the mouth can induce an generalized inflammatory response, and particularly in the placenta, thereby disrupting the normal fetal development. Now, the second microorganism that we're going to be talking about is Streptococcus mutans, which is S mutans. Of course, let me back up a little bit before I move on. Last week, we also talked about the connection between Porphyromonas gingivalis and pancreatic cancer. So that is being established, and more research is being done on that particular topic, so that in future, when there are more information about that, we can share that on this forum. So let's move on to the notorious Streptococcus mutans. This is the one that most of you have been exposed to. Let's say most of us, because I'm part of the population. So most of us actually have been exposed to this. If you have a toothache, if you've ever had a toothache that was due to cavity, definitely you have experienced the scourge of Streptococcus mutans. Streptococcus mutans is a major contributor to tooth decay and cavities. So this bacterium mobilizes dietary sugar. So, like if you chew anything that is refined carbohydrate, or you drink your tea, coffee, or whatever with a lot of sugars, the strep mutans is very happy. That is what strep mutans is looking for. Anything that is refined carbohydrate or sugars will be the substrate for the spread or the multiplication of the strep mutans. So we need to watch what we eat. And if we eat, just like Herman in London just said, hey, listen, I've just gone to brush my teeth. It's time for bed. After Medical Mondays, that is wonderful. At least you reduce the amount of sugars in your mouth when you go to sleep. If you're going to have a long time between meals, it is also advisable to reduce the acidity in your mouth by sipping non-acidic fluid, preferably hot water, in between meals. Anyway, so let's move on to what are some of these screening and diagnostic tests that are available to identify these dangerous oral microbes. The first one that is very powerful, and this one is, I'm sure if you've done COVID tests, you probably have heard the term, not knowing what it really means. You've heard about PCR test or PCR-based test. It's similar to what you've done, if you've done COVID tests and they did PCR. This is a polymerase chain reaction in which case some genes are going to be amplified and then be able to, no matter how small the quantity is, they can amplify it to be able to detect that is actually present in the system. So this PCR-based test, being a powerful molecular technique, can detect the presence of P. gingivalis and strep mutans by amplifying their genetic material for analysis. So there are so many commercial labs that are offering this. Almost every commercial lab that does, biological analysis for diagnosis and screening will be able to do PCR tests. If you told them what genes you are looking for, they can actually detect it and be able to amplify that and then be able to tell you whether it is present or absent. So the next one is the salivary test. The salivary test is a non-invasive screening using saliva samples. This may not be, commonly available to primary care physicians, but I think knowing about it can broaden the horizon of the primary care physician as well as the dentist. There is a lab which is called Oral DNA, which is reputable, is a very reputable commercial lab that offers screening and diagnosis tests for P. gingivalis and for other pathogenic organisms in the mouth. If you're going to request for this as a primary care physician or a dentist, you should request for the MyPeriopath, which is a package which is for screening and diagnosing oral pathogens. So in that case, if you need, once I finish talking, I can copy the information about the website and their phone number and post it in the chat. And then you can continue with our discussion. The next type of test is the microbial DNA sequencing. This is an advanced technology which enables comprehensive analysis of oral microbiome, allowing for the identification of specific pathogens. There are so many commercial labs also offering this. And you can also request for that from Oral DNA. So I think I've already talked about Oral DNA. I'll post the link and the other information about detecting P. gingivalis, which is the most notorious of all the pathogens in the mouth. All right, so let's see, what are the remedies that we have? The first remedy is simple home care. Simple, what I mean simple is that you can just make sure there is no plaque in your mouth. If you can make sure your plaque is not in your mouth, using your washcloth, that's perfect. I'm not saying that's what you should use, but the goal is very clear. Once you know what you're trying to clean, then you know how to clean it, and that is very important. But there are so many devices out there, from very cheap or from zero cost, which you call $0.99. It costs $0.99, as well as those ones that cost up to $1,000 for a device to clean your teeth. Whichever one you have access to, using them efficiently is very important. So the goal is, make sure you know what plaque looks like, know what plaque feels like, and then attack the plaque whichever way you know how. But I think the simplest way is either you have a chewing stick as we do in Africa, or you use the commercially available toothbrush. There are commercially, available toothpaste as well, but I do not generally advocate toothpaste. Not because they are not good, but because there's coexistence of good and bad with most of the toothpaste. So we've talked about the use of baking soda and hydrogen peroxide many times on this forum. So I'm not going to belabor that, but if anybody still has questions about that, we will elaborate more on that. So the last thing I would like to talk about is the commercially available probiotics, because I mentioned probiotics as being one of the most effective ways of controlling the imbalance. What we were talking about imbalance last week was when the microorganisms or the bacteria, the fungal growth in the mouth is overwhelmingly negative. In other words, that is, they are not the beneficial microorganisms that are multiplying in the mouth. We describe that as being an imbalance in the oral microbiome. So what we try to do is to reduce the population of the uh, unwanted pathogenic bacteria by introducing the healthy and the beneficial bacteria into the mouth. And it's similar to the same principle or the concept of having the colon cleansing by adding probiotics and fermented food to your food regimen in order to cleanse your colon. The same thing is going on with the mouse. If we introduce the right bacteria, the bacteria will outpopulate, the probiotics will outpopulate the bad bacteria in order to reduce their effect, their damaging effect in the mouth. So the probiotics for oral health, the beneficial bacteria that can help restore and maintain a healthy oral microbiome. So which of the commercially available probiotics are we talking about here? I mentioned a brand, ProDentim, last week. I don't know if anybody checked on that online. They have an infomercial that can also give you a little bit of exposure. But the bacteria that I mentioned last week are primarily contained in ProDentim. As a disclaimer, I do not have any financial interest in ProDentim. So if anybody wants to explore that, I believe that it's a very good, it might be a good product to look into. Another probiotic that is available is called Probiotics. It's Probiotics. So you can check that also out. There's another one called Oral Balance. There's another one called Microbiome Guard. I don't know the availability of this, widely, but these are the commercially available oral probiotics that seem to help adjust the imbalance in the direction of being healthy. These probiotics contain strains such as I mentioned last week, which is Lactobacillus salivarius and Streptococcus salivarius K12. The K12 is very important for you to know, so that when you're trying to look on the label, you must make sure that it does have that particular strain. So these are the primary microorganisms. I mentioned also the microorganism that actually attacks the Porphyromonas gingivalis primarily, and that is the Streptococcus salivarius K12. So you have to remember that if you try to eradicate the the multiplication of Porphyrin monas gingivalis in the mouth. So let me just conclude by saying the exploration today into the microbiome's impact on systemic health has done a little bit more than what we did last week, so that you can know that there is help. So these pathogens that we have, discussed today has been linked to various systemic diseases, including cardiovascular disease, respiratory infection, rheumatoid arthritis, and adverse pregnancy outcomes. These are the main ones, but I'm sure the effect is far-reaching systemically than just those areas. So some of the diagnostic tests, the PCR-based tests, this is just a recap. Salivary tests offered by, this company, the Oral DNA, which is the primary lab that offers that. And if you're looking into probiotics for the mouse, you might be looking at products from ProDentin, Probiotics, Oral Balance, and Microbiome Guard, which contain the beneficial microorganisms. Thank you.
Wow. Thank you. Thank you so much, Dr. Ajagbe.
You're very welcome.
I have a story that I wanted to tell, but I'm going to ask the questions on the platform first. But before I go there, Dr. Craig, Dr. Bill said, there is a probiotic out of Sweden called Panactive. The LB and other bacteria are attenuated and kept cold, but it's only available in health food stores, I think is what he said. Correct, Dr. Bill?
Yes.
Fantastic. You also said, other than swelling, Dr. Ajagbe, what are the other symptoms? Because he said it sounds difficult to pinpoint the issue of PG. So other than swelling that you described, what are the other symptoms?
Oh, I mean, P. gingivalis is the most virulent and most pathogenic bacteria that colonizes the mouse. One of the first things that it does, it causes bad breath. I mean, that is very pervasive, and you can attest to that. If you choose not to brush your teeth for a few days, you will know the effect of P. gingivalis, even though you may not have gum inflammation and all of that. But if you keep it long enough, P. gingivalis has the ability to release certain enzymes that actually destroy the connective tissue. So the destruction of protein by the enzymes that I describe as PADS is actually one of the main destructive functions of P. gingivalis. Now, when it goes down into the gums, it's like irreversible, because most of the time, if it actually destroys the gums, before it destroys the gums, it is swollen first by being inflamed. The inflammatory process is the body's mechanism to try to ward off the infection. However, while the body is releasing, while the white cells are releasing their enzymes to destroy the bacteria, they are also destroying the soft tissue, because the enzymes they are releasing are collagenous as well. So it's a kind of like double whammy. And then the P. gingivalis, once it gets into the bloodstream, is when it does the most havoc. Okay, so you can see that all the examples that we gave on the cardiovascular, the respiratory, the joint, as well as pregnancy outcomes, they are just the tip of the iceberg. And those are the commonest ones that we can talk about, but the effect of P. gingivalis is widespread.
Thank you. So he also asked, does the hydrogen peroxide used consistently over a period of time wear down plaque buildup?
Well, okay. So plaque buildup is not something you do once and for all.
No, he
No.
said, is the use of hydrogen peroxide over a period of time, does it wear down the plaque buildup?
I'm going there. So what I'm the reason I said that first is to say that it's not like if you use the hydrogen peroxide once or a few times, then it will confer a protective, effect on the formation of plaque long term. No, plaque will always form as long as you eat, as long as you have bacteria, as long as you have food, long as you have saliva, you will have plaque formation. That is why every night, even after you've brushed, before going to bed, when you wake up in the morning, you feel the surface of your teeth are not as smooth as they were before you went to bed. Now, that is because the mouth is not stagnant. The mouth is dynamic. Things are happening whether you are sleeping or you are awake. So if you use hydrogen peroxide I use it consistently. I use it on a regular basis. I don't see any side effects from hydrogen peroxide. If you use 6%, it may be too strong for you. And I know some people in the world will say if 2% is good, wow, 6% will do wonders. Don't go that route with hydrogen peroxide. It will burn you. The stronger the concentration of hydrogen peroxide, it will actually destroy the soft tissue. So you need to be very careful about the concentration. I always tell people 3% hydrogen peroxide is perfect. If you cannot handle 3%, then do 50-50. 50% of the hydrogen peroxide diluted with 50% with equal amount of water. So that way it makes it 50-50. That way you end up with 1.5%, and it should not be that strong to hurt your soft tissue. So, you need to keep using this. If you don't want to use it regularly, it's okay. It's not like you will revert back to severe gum disease. It just means that whatever is left in your mouth will have their effect. That's all. The hydrogen peroxide is very effective against anaerobic microorganisms. That is, microorganisms that hate oxygen are the ones that have been attacked directly by the hydrogen peroxide. And also, hydrogen peroxide destroys all organic putrefactions in the mouth, which is the reason why in the past they used it to cleanse chronic, ulcers, non-healing ulcers, to get off the necrotic tissues from under there. So that's what the hydrogen peroxide is used for.
So over time, would it debunk plaques?
No, it would not.
Thank you. That's okay.
That's the answer.
That's the answer. Thank you. No, it won't. Thank you. Dr. Bill, you got your answer. So Brother Chris from Nigeria said, some people brush their teeth, but they still have bad breath. Why is this?
Well, incidentally, we talked about bad breath a while back. We might still talk about it again. Bad breath is not just one, it's not caused by only one situation, okay? Bad breath can be caused from a whole lot of things. The kind of food that you ate that actually fermented in the mouth, the decay of the gum, of the teeth, the smell of the decay is different from the smell of gum disease. and it's different from the smell of coated tongue, and it's different from the smell of people who are mouth breathers. So the professional or the dentist should be, will be able to help you identify which one in particular is the situation. So bad breath is a big problem for many people, and it can be very easily addressed.
Thank you. Thank you, sir. So Dr. Craig says, how often do cardiologists associate gum disease with poor dentition, that is, issues with valves, heart valves? Do you want me to throw it to Dr. Ezugu?
I was going to ask you, are you asking a cardiology question? Dr. Ezugu will be able to...
You know what? I already asked you before I started thinking, wait a minute. Dr. Ezugu, kindly chime in. How often do you associate gum disease with poor dentition, that is, issues with heart valves?
As a matter of fact, any person that comes in with any issue with heart murmur or anything like that, we become concerned that the mouth is the source. And our examination always starts from the mouth because, yeah, even just dirty mouth or any bacteria that can seep through bloodstream into the valves. And even before we even do any surgery let's say when you have blockage and need surgery, we have to go through dentists to really look through and remove any abscess or any cavities even before the surgery gets done. Because if you put the valve in, it can easily get infected. And so we really, really, really emphasize, proper oral hygiene for all our cardiac patients, because not only does it lead to disease, it also affects the ability to, take care of the patient when the disease is there already, especially when you have any instrument, even pacemaker or anything, it's a problem. Yeah.
Thank you.
Sure,
Excellent question.
Yes.
Well,
thank you so much.
But on our part, if there is any patient that has been diagnosed with heart murmur or congenital heart defect, before we do anything, we normally will do, what we call
Clearance.
No, not just clearance. We do the prophylactic antibiotic.
Yeah, we do, prophylaxis. Yes.
We give prophylactic antibiotics to them or see them. Even if it's an emergency, we have to cover them with antibiotics before we even do examination on them. So that's how we.
Yeah.
Thank you. So this question, you said it, when you were presenting, that if this issue comes up, you'll talk again about it. The question of baking soda and hydrogen peroxide, I think, is something that, people still want to know a little some about. This question says, what are your thoughts? That is Harry. Oh my gosh, Harry, how are you? It says, what are your thoughts on using baking soda to help combat plaque and gingivitis? Dr. Ajagbe, when you're answering that, I have a family of Medical Mondays with Dr. O, who told me last night that she actually brushes with baking soda, hydrogen peroxide, and turmeric. So if you lump that together and please address that for us, that would be great. Harry, great question.
Well, okay. Thank you for that question. See, the issue of baking soda eventually will come to the forefront because it's the most balanced source of cleansing the mouth. However, because it's very affordable and manufacturers don't make a lot of money from that, it's going to be looked upon as not being necessary. But everybody is finding out. I mean, most people are finding out. So the question of baking soda being very important in cleansing cannot be overemphasized. It's an alkaline product, and it actually neutralizes acid in the mouth. So a lot of people are coming up with all kinds of stuff. I got a video clip that was sent to me today. Somebody demonstrating mixing their own preparation of baking soda with coconut oil, with cloves, and then saying they soak their cloves in water and then use the cloves to rinse their mouths. So everybody's going to come up with all kinds of ideas. The issue is straightforward. The issue is that these natural products are very effective. If they are used properly, they are very effective against what we're trying to spend so much money and time to correct. So the whole idea of my sharing this for the longest time is just to let people know that this is a simple matter that can be addressed very easily. So turmeric is supposed to be an anti-inflammatory product. If you add turmeric to your mix, it's just because, well, I don't want to say anything crass, because you think turmeric is very useful, but without the addition of black pepper, turmeric's anti-inflammatory property is not released. So if you're going to do that, you need to add black pepper to your mix. If you are doing baking soda with turmeric and whatever else you are adding to it is fine, as long as they're not going to be irritants to you. So I would say it's okay. People are going to come up with all kinds of combinations. So it's all good.
Oh, Sister Shade said, do we have to dilute hydrogen peroxide with water? I think that's what she was asking.
Well,
you talked about the percentages, and I'm wondering if that was before you talked about, 3%. Okay.
It could have been before I spoke about that. And then I saw something flash through my screen. Herman is saying that he uses 6%. Well, all power to you, Herman. If it's not affecting you negatively, I guess it's okay. My advice is don't use it if you know your tissue will not tolerate it, because it's going to burn your mouth. I can tell you that.
Okay, thank you. So, Dr. Bill, you have your hand raised. Go ahead, sir. Unmute yourself.
Okay. A couple of things. You mentioned an antibiotic use, just to cover in terms of issues. Is there a antibiotic of choice given the patient's age, gender, medical issues? That's one question. And I have another question. Maybe you can answer that one first.
Well, the preference is based on allergy. A patient that is allergic to penicillin, for instance, would not be given penicillin-based, antibiotics to prevent, prophylactically. Any patient that is allergic to streptococcus strain of, a bacteria will not be given streptomycin. So we have quite a few different antibiotics, but we choose them based on the patient's allergic reaction.
The other part of that question is I've had patients where they have just been used, antibiotics were given, with a good thought, but unfortunately, it was a premature use. So all of a sudden we are writing for antibiotics, and now when a major issue comes forward, there's not very much I can do in terms of or suggest in terms of antibiotic use. Now we're looking at cocktails. We might do Venco, we might do something else, because we know that one is no longer of value. And we're in major issues in terms of that, especially as you pointed out, in terms of you know, the heart impact in terms of our poor dentition, and that's a real factor.
Well, we when we do this, we do it pretty much for that particular appointment, and it's just to prevent transient bacteremia. So if you understand that, what we're trying to do is just by manipulating the gums, if by any chance we have, you know, bacteria going from that particular site into the bloodstream, that is not going to cause a heart, you know, valve problem down the road. So we do that being proactive. But we are not doing the long-term, you know, like abusing antibiotics to the point where it's no longer effective when it's needed, if that's what you're alluding to. Using of cocktails and all of that may not necessarily be because we use the prophylactic antibiotics in dentistry. So because it's better we did that than not do it, and the patient now has an unwanted side effect to just examining their gums. You see what I'm talking about?
So that makes sense. That makes sense, yes.
Basically, from our own standpoint, not only do we protect the health of that individual at that moment, but we also protect ourselves from exposure to, you know, any kind of malpractice. Because if you don't see that as a standard of care for a patient that has heart murmur in your clinic, if anything happens to them, they can attribute it to just one appointment. And you don't want to be in that kind of situation.
Understood.
So, Dr. Craig, there are issues with antibiotics, but the dentists are not the ones that are the culprits. I agree 100% with Dr. Ajagbe. And the cardiologists are not the culprits either. So the problem with antibiotics, I'm glad you brought it up. You fantastic at bringing up these important issues for us to discuss. See, when a doctor prescribes augmentin, for instance, dentists prescribe augmentin a lot. And it's important because it penetrates the oral cavity. It penetrates where they need this thing to go. It does what it's supposed to do. So it's usually their first line. When doctor prescribes antibiotics, it doesn't matter if it's dentist, you know, any kind of doctor, and they say, take it twice a day, with or without food, whatever they say, and take it for 7 days or take it for 10 days. There's a reason for that. See, when you take that dose of the first dose of antibiotics, it clears a percentage of the bacteria. You know, the number is reduced, but the bacteria is still there. Then it's suppressed though. When you take that second dose, it suppresses it even further, clears another percentage, and this goes on. People start feeling better because, you know, the antibiotics is doing its job, but the bacteria is still present. Some people, they feel good and they stop taking the antibiotics after 3 to 4 days. What happens to the bacteria? It starts rapidly multiplying again. Now, it may wisen up and then mutate. Mutate means it actually changes some.
Toleration.
So that particular antibiotics that was used before will not work on that bacteria anymore.
Correct, yeah.
Because it has changed some. The patient did not allow it to clear completely out of the system. You need that 7 days, that 10 days. I've seen patients that will say, oh, they have something. They started taking antibiotics that was given to them like 6 months ago, what they had left. Antibiotics is not the type of medication that you should have left. You have to complete that regimen at that time when you are given. Pain medications you can have left. When the pain is gone, you don't need to take the medication again, and you will not develop resistance or anything to the pain medication because you stopped it. But antibiotics are not like that. They can be a beast. And that's when people develop resistances and then they get into trouble. Maybe now they have infection in the bloodstream. The infection goes to the bloodstream. Now they're going to need cocktail. Cultures have to be done to see, what is then good for them. But before the cultures, you have to grow it. You can fast track it. You have to grow it to know what would actually control that bug or kill it. So before the culture result comes out, the number of days it takes, like 5 days, they have to start things like Vanco, something that is broad, vancomycin, something that will cover more pathogens because we don't know what we're dealing with. But we don't want this patient to get into more trouble. So we will use what we call broad spectrum antibiotics, something broad to cover until, cultures results are out, and then we can then fine-tune treatment again. So please, this is a very important question. If you're ever giving antibiotics for anything, if it's the dentist that gave it, your primary care doctor, your cardiologist, nephrologist, anybody, please complete that regimen for the number of days. There's a reason for that, even when you are feeling well already. Thank you for that question. So,
Absolutely.
Dr. Ajagbe, is there a preventive treatment for receding gum lines?
Well, receding gum lines could result from a number of reasons. One of them is chronic infective process. That is, every time you have gum disease and it seems to resolve by itself, it will shrink the gum because it's healing by secondary intention. Just like a chronic wound will heal and have a scar. But you don't see the scar on the gums. The only way you know something bad has happened in that area is the gum recession. So you see that the gum is no longer covering all the part of the mouth that is supposed to cover. Now, part of the neck of the teeth are now showing. So that's a problem. So there is really the precaution for that one, or if you want to do it proactively, is to prevent gum disease. If you prevent gum disease, definitely your gum will remain healthy and anatomically the same way it has always been. If you are the type that grind your teeth or clench your teeth, definitely that also causes a situation whereby we call it abfraction, in which case the chipping off of the enamel around the neck of the teeth begin to appear because you have been clenching over a long period of time. Engineering design of the tooth allows for the transmission of the forces when you clench your teeth to be transmitted to the weakest part of the crown. And that is around the neck of the tooth. And when you see it, you see like it's a little crescent of pit. It's smooth. It's not like it's cavity with decay, but you see that it's smooth. If you put your nail there, you can actually feel it. You can feel the catch with your nail. Once that is happening, you are clenching. Even if you don't catch yourself clenching, definitely by the way that is formed, so the only way to prevent that is to stop clenching. Because once you lose gum tissue around that, the gum tissue does not grow back. Once you lose it, it's gone. And whenever you lose bone, the gum must follow it. If you lose bone, the gum will follow that loss. So if your bone is receding down, your gum will follow it. Your gum will still be a little above the bone, but it will go further down, compared to where it used to be. Those are the two primary reasons why you can see obvious, gum recession. There are other conditions, that are not very common, but, as anything that even some people have habits like putting their nails in their mouths and pushing against their gums. And, I don't know why anybody would do that, but they do it. And I've seen patients do it in my presence. And I'll say, did you notice that you are doing something like this? They'll say, no, I did never. Oh, thank you for telling me. So they can start catching themselves doing that. Some people use toothpicks, the wooden toothpicks or the broomsticks, not the broomstick, the big broomsticks in America, but the little broomsticks from the palm frond that Africans used to sweep the floor. Some people will take a little bit of that, it's a short segment of the broomstick, and stick it in their mouth. It's constantly in their mouth. They're constantly poking. And once they do that, what they are doing is they're actually tearing away the gums from where they're supposed to be. And eventually the gums will respond by actually moving away from that space. So if you look at yourself and you have been guilty of, keeping toothpicks in your mouth, well, catch yourself and then start reducing it or get rid of it completely. So that way you can at least prevent further severity of gum recession.
Thank you so much. Was your question answered? Sister Shalon, was your question answered?
She said yes, 10.
Great, because she's like preventive treatment for receding gum. Sister Sade asked.
Yes, it was. Thank you.
Thank you. She asked the question, but she says, what is TM? I think it's TMJ. She wants to write. She says jaw pain associated with jawline.
Okay, so the TM joint, if you put your fingers, your 4 fingers in your ear hole, and you open your mouth and close, you will see the joint moving. If you do that, as simple as possible, you will feel the movement of the bone. When you feel that movement, that is what we call the TM joint. It's a joint between the temporal bone and the mandible.
A mandibular joint.
So that's why it is called temporomandibular joint. So when you have a problem with your bite, most of the time people don't realize that it's their bite that is the primary cause. If your teeth are not lined up properly, you are transmitting forces in the wrong directions. The forces that are supposed to go vertically can become horizontal. And when that happens, it causes so much force resolution everywhere where there's movement. One of them will be in the gum, in the socket where the root of the tooth is. There will be movement there. There will be movement in the TM joint, which is the bone of the jaw that actually moves. You can feel it. When you do exactly what I asked you to do, you will see that anytime that happens, you have the tendency to crush if you have the wrong forces, there's a little bit of fibrocartilage which is between the surface of the mandible, which is the part that actually moves. That's the part of the mandible. We call it the condylar head. The head of the mandible is inside that joint space. All right, there's something that separates the surface of that bone from the base of the skull, where the temporal bone is. So now, if that little cap, that we call it cap, it's because it looks like a cap, but it's in between the joint, that if that is trapped, in the wrong place, it can cause pain. If it is worn down to the point where there is a hole in the center, which means the two bones are now rubbing against each other, there will be severe pain. If you clench through the night and you are pushing on that little little cap that I just described, a few seconds ago, if you trap it because you are clenching tightly, you will wake up with pain or headache on the side, on both sides or on one side, wherever the force is, the force of mastication or force of clenching is higher. And sometimes you find the pain transmitted to the jawline, right at the bottom, from the lower part of the ear all the way to your chin, along the line of the lower jaw. So all of these things are signs that there's a problem with your bite. And sometimes the bite can be obvious, sometimes it may not be obvious, but those who know how to diagnose that can help you resolve that problem.
Thank you, Dr. Ajagbe. That can be a pain in the behind. Sister Tinuade said, thank you, Dr. Ajagbe, that she started using baking soda at night before going to bed. I think that's
excellent.
Excellent. Yes. So, Dr. Ajagbe, this thing you talked about, strep mutans, I wanted to take you down to memory lane. You remember one time I was traveling to the UAE, and I came to you because I felt uncomfortable in one of my teeth. A tooth bothering me. You remember that?
Yes.
And I went to Dr. Ajagbe, and Dr. Ajagbe sent me to do an x-ray. And I remember sitting in his office and him saying, this thing on the bottom here, there's a bubble. And it looked like it could be the beginning of an abscess. He threw it, and I said, but you know what? Let's watch and see. And I was traveling. So he put me on Augmentin. And at the airport, I was on transit. I think it was in Germany somewhere. I was so fatigued, which is so unlike me. Walking from the plane to the gate, I usually like to stop by, get, whatever. I didn't get anything. I just went to the gate and I was alone there. I laid down on, like 2-3 chairs like that. And I slept off. I slept so soundly. Something woke me up last minute. And I was like, oh my gosh, the place was packed, and so went to check. My plane had boarded. I was the last one on that plane. I could have missed my connecting flight. Well, I got to the UAE and my husband and I went shopping. And that had never happened to me before, that I thought I physically could not walk to the car. But I'm not a complainer, so I didn't complain. It took all I could to make it to that car, but I didn't complain. I didn't say anything. I got in and I collapsed. Dr. Ajagbe, you remembered that my husband and I FaceTimed Dr. Ajagbe and I had a huge abscess. I found it myself. I'm like, something is not right, but I didn't know where. When we're talking about oral issues and systemic problems, is why I brought this up. Physically, systemically now, I was devastated. But it started with an abscess in the gum. How that happened, I don't know, because I do take care of, I thought I was doing a good job with my dental care, but I wasn't using baking soda and hydrogen peroxide. So Let me say that. At that time, Dr. Ajagbe even have not taught us about hydrogen peroxide and baking soda at that time. He too did not know. I'm talking about, was this 2009, 2010, somewhere there? Dr. Ajagbe, somewhere there, maybe 2012, I don't know, somewhere
Right.
there. Anyways, we FaceTimed Dr. Ajagbe and I saw his eyes. It looked like he was going to pass out. But it quickly, regained composure. And, we dialogued on how I should be treated and all of that. And got on doxycycline and cleared that infection. But that was a close call. That was a dangerous situation. Can you tell us a little bit more about that? You remember this? I said I was taking you down memory lane.
Well, I remember that accurately. The issue is, as you rightly said, the connection between oral diseases and systemic conditions cannot be overemphasized. This is being established. Initially, it looked like it wasn't going to be important because, but yes, I remember that clearly, but I don't want to go into the details of how that was treated, but you've addressed the essential part of it. Yes, it was good that you could have that taken care of remotely because you have somebody who could help you do it. What would have happened if you didn't have anybody to help you? And you're in a country where you know nobody. God forbid that it actually happened when you were in Germany in layover. Yeah. And there's nowhere you can run to right away. So what would have happened? Now, it was interesting that I insisted that you will have antibiotics that night because you actually called me out, late in the evening to see you. I said, well, if you can meet me at the office, I'll take a look at what is bothering you before you travel. And then, so thank God that happened. Suppose I didn't put you on antibiotics. Or suppose you decided you are not going to take the antibiotics, then what could have happened? So
a different story.
So it is very important that some of these things should be, identified. We should try as much as possible. Let's not trivialize a lot of things. I try to make cleaning your mouth easier by saying you can have access to baking soda. It's not expensive. It's not dangerous. You add baking soda to your pancake. You add baking soda to so many things. So swallowing baking soda is not going to kill you. It's not going to destroy anything. If anything, it's going to reduce the acid in your mouth. And if you have excessive acid in your stomach, it will help you control it as well. So let's not miss the point. The point is there is a major connection because the mouth is not separate from the toe. The mouth is connected to the toe. Mm-hmm. You can say it's a long way, but the mouth and the toe, they are neighbors, no matter how close or how far from each other they are. So if the small toe, it can feel the ailment from the mouth, well, that means we must take care of every part. So that's what I think should be the lesson from the anecdote, which is just being shared with us. We also need to know that the issue of antibiotics, you need to remember, history, your medical history, particularly when you go for a dental checkup. Because if you don't remember that you've been diagnosed with heart murmur before, and you say, oh, just treat me, and something happens, then you say, you don't want to be in a position where you are arguing whether you said it or you didn't say it. And if you say, oh, yes, I forgot to mention it, the damage could have been done. So I think the best thing is let's remember our medical history, particularly if you're going for dental checkup. Just share it with them. tell them, oh yeah, I used to have a heart murmur, but I haven't checked it lately, whatever. Or they said I have a valvular problem in my heart, and so on. That way you can be actually protected from any kind of adverse effect from your appointment.
Thank you. Thank you so much. I have a question here that can you speak to chronic hypocalcemia, which is correlated to
Vitamin D levels.
Yeah.
Well, the issue of calcium concentration in the blood is always like a moving target, because you have to think of it in terms of the concentration of phosphate as well. So hypocalcemia may not be real hypocalcemia, particularly if you don't, if you don't have the right amount of phosphate that's supposed to balance the calcium in your system. Yes, there could be a problem, if you have severe hypocalcemia, but it's not in the calcium of the teeth. So we gotta bear that in mind. Once your teeth are fully formed, you do no longer use calcium in your bloodstream to maintain anything in your teeth unless you have a cavity and there's a healing process going on from within the tooth. So let's say you have healthy 32 teeth. Calcium concentration in your blood does not affect the health of your 32 teeth. Now, if you have osteoporosis because of menopause and your blood calcium level is low and it's affecting your your bone, your jaw bones, yes, it will affect your healthy teeth, because once you lose bone, the anchoring of the teeth to the jaws will be lost and your teeth will become loose and you may lose them. So if there's any pharmacologist in the forum who wants to chip in on that, pharmacokinetics of calcium concentration in the blood, I think we should listen to that person.
May I add?
Please.
The calcium, to my understanding and knowledge, is the most balanced item in all of our bodies. And as you've just alluded to, I'll say 95 to 96% of the calcium is basically a bone. That 4 or 5% is the item which the body uses to protect itself. And you've also mentioned phosphorus. The calcium phosphorus must be balanced, because the body would then, the parathyroid gland would then go to the bone and resorb it and try and keep it balanced. And that's when we start losing bone issues completely. Significant problem. But I was speaking of the fact that, and basically you've answered it, that, not until the balance between the calcium and the phosphorus is out of whack for a very long period of time do we start losing jawbone, which then is the anchor of our teeth, and we start losing our teeth. So you're absolutely correct in bringing that forward. Thank you, Doctor.
You're very welcome. Yeah.
Thank you so much, Dr. Ajagbe. There's a situation also. One of our family members on Medical Mondays said she went to have her teeth cleaned, and the person cleaning it just dug into her gum for every tooth, that it hurt so bad. And I said, why didn't you ask them to stop? She said, at first she was taking the pain and then eventually had to say stop. She couldn't do this anymore. But what then happened afterwards was that he dug so deeply into the gum, separating it from the teeth, and several of them, that created problem for her. And she actually lost a tooth.
Well, I'm not
It's cleaning.
Okay. Let me just say something. I don't want to trivialize what is being shared here, and neither would I want to sit as a tribunal judge over what was done. So let's maintain a balance here. If you go to a dentist and you don't have a gum problem, and they want to do a deep cleaning for you, you ask for a reason why they're doing deep cleaning for you. There's a way you can find out that you really need deep cleaning, not just a fictitious disease. Deep cleaning is when you do have a deep pocket. If you follow what I'm trying to say. The deep pocket, I described it earlier when I was talking that if you start losing attachment, let's say you have gum inflammation and your gum is swollen, that's the first step. You now have plaque under that swollen gum that your toothbrush is not reaching. And then over a period of time, that the plaque keeps on accumulating and then starts getting hard and becomes calcified. Calcified means calcium is deposited in it, and that's what we call tartar buildup. Sometimes you have tartar buildup above the gum line that extends into below the gum line, which your eye cannot see. So now, if you've had calculus buildup or tartar buildup over a period of time, the chances are that the calculus started from under the gum and is pushing the gum away. So if the calculus or the tartar buildup above the gum line is cleaned at the first appointment, then we can see that there's something else below the gum. When you see something else below the gum, because the one covering the gum line, it will prevent you from seeing it. Even if you try to move it, you move the gum, you don't want to tear the gum away. So you wait until you remove the top part, and then you can see what else is left below the gum line. In most cases, if it is very deep, we tell the patient, or the dentist will tell the patient, listen, you have deposit below your gums. Your gums are swollen. In order for your gums to heal, we need to remove the irritants. The irritants are below the gum line. Without removing the irritants below the gum line, you will have problems. Even if you go home now and your teeth look cleaner, but the problem for your gum will still remain. So let's say you have agreed. Now you agreed, okay, what can we do to clean off this irritant from my gums? Say, oh yeah, we're going to do deep cleaning. Deep cleaning means we're going to have a way of going below your gum line to remove all the tartar buildup, not leaving anything behind, because any rough surface will cause your gum to swell. So what has happened when you have such complaints, yes, your gum must have been inflamed before. When your gum is inflamed, part of inflammation is tenderness. So just touching it without numbing you will make you very uncomfortable. So in most cases, for deep cleaning, except the patient says, please, I can handle it, don't give me anything. Some patients prefer not to feel numb 3 hours after they have been treated, they'll tell you, I can handle the discomfort for a few minutes, so you can just go ahead because I don't want to deal with the numbness after the treatment. So you reason with the patient and treat them like that. But once the patient begins to complain, yes, whoever is doing the cleaning normally will stop and say, okay, we'll give you some, can we numb it for you now? Because sometimes some patients will change their minds. They say, oh, initially don't numb it, but later they say, sure, let's numb this because it's very uncomfortable. And that's the way to deal with that. Nobody should go through discomfort while receiving their treatment. It's better to make your concerns known early, and you don't need to you don't need to suffer through anything. There is no virtue in that. If you're uncomfortable, just say, look, please, I need something to be numb. Not in a very rude way, but it's just letting them know that you have concerns about the treatment going on.
Thank you, Dr. Ajagbe. That was awesome. So, do you have any parting words for us?
Can I ask a question before he parts?
Yes, my doctor.
Yeah, thank you, Professor. Very interesting as usual. And the purple matches Dr. O's purple. So I don't know what's the link.
Uh-oh, he was looking out my window then because I was looking at his.
Two questions. Well, the pocket reminds me, I used to have a pocket when I was in medical school, and I always had to go and have it cleaned, one of my molars. But what I wanted to ask is there a chart or some information that you could, or a place you could refer me to? I'm going on a medical mission to Guyana, and there's some employees at my husband's firm. I would just like to talk about something about oral health. Can you put a chart, tell me where I can get a chart or information that I could show them? Because I'm sure they don't know about that. And I used to get hydrogen peroxide from CVS to spray, but they took it down. Can I just mix the baking soda in a little bit of water and brush with it?
Okay, so did you say that the hydrogen peroxide is what now? What percentage?
I don't remember. It was a spray. I don't remember. It wasn't that. Maybe it was 3 or less. It wasn't very strong, but I don't see it in CVS anymore.
So you prefer the spray? Is that what you're saying?
Anyone? I don't even see the regular one anymore.
Okay, so
I have some bottles of the regular one.
You could check any other any other drugstore you should find. Usually they have them in the first aid area.
Okay.
So if you look at the first aid area, you'll be able to find it. If you have Costco card, then you can buy a dual package. They sell them in pack of 2s. So you can just buy quite a few in your cabinet. I think it's only about $2.99 or something for a pack of 2. So, and that's a lot.
I said they have it at Walmart too.
Yeah, they have it at
every grocery store. Every grocery store carries it.
Yeah, so
any grocery store. Okay.
You find hydrogen peroxide almost everywhere you look. So
Dr. Ajagbe, 1 minute. Let me just explain this. They come in this dark container, very dark brown container, and you can just squirt it. It's very easy. You squirt it and cover it right away. Very easy. It's better than spray, I'm sure.
Yeah, actually, the reason it's in black or dark bottles is because of light. It's photosensitive.
It's oxidized. Yeah.
Yeah, if you expose it to light, it will start losing its fizziness. So that's why you have to keep it covered in a dark, opaque container, whether it's a plastic bottle or glass bottle. It will be very beneficial. So the chart that you're talking about, Dr. you can give her my phone number so I can get you some resources. That way, you can share with them, and that would be fantastic.
Thank you. So with baking soda, just dissolve it in a little bit of water and brush the teeth, or throw it on the toothbrush. Which one? I
would put it on my toothbrush.
Okay.
You know what? Because it's abrasive for a few seconds. The abrasive nature of baking soda initially, before it dissolves, is very beneficial. In fact, it makes your tooth much smoother than just brushing teeth with the dissolved baking soda. So go, dip your toothbrush. If you like, you can dip it in the the hydrogen peroxide first, and pick up, fresh baking soda powder, and then because it will foam when you combine the two together.
Okay.
Once you combine them together, it will foam on your toothbrush, and then you can use it to brush your teeth.
Okay. Thank you.
And then you can use the peroxide to rinse your mouth first, then you rinse with water.
Thank you.
After brushing the teeth?
Yes. Mm-hmm.
I see.
So look, there is no hard and fast rule on how to do that. What the most important thing is that you're combining the two as part of the cleaning regimen. Sometimes when I first wake up, I just put a little bit of hydrogen peroxide in my mouth, let it foam. I swish it around, then pick up the baking soda on my toothbrush, spit out some of the hydrogen peroxide, and start brushing. So it will foam together in my mouth. And then, of course, the abrasive property of the baking soda also is very useful. And it does not wear your enamel down. It doesn't wear your teeth down. Like if you are using the toothpaste. The toothpaste are using silica-based, abrasives. So which are like using sandpaper, very fine sandpaper on your teeth. Long term, you're going to lose thickness of your enamel.
Thank you so much.
Thank
This
you.
is interesting. I don't know how many times you've gone over this, but every time it's like I'm hearing it for the first time. This is crazy. Thank you. And thank you so much, Dr. Booker, for taking the time out to go bless our people back there. God bless you. Thank you.
Thank you.
Sister Tinuade, you have your hand raised?
Yes, ma'am. Thank you.
That's it. Change your phone again. Attorney Tinu, welcome.
Hey, it's okay. I'm Tinu Akinshola. Simply. Thank you. Dr. Ajagbe, thank you so much. And Dr. Booker, you just enriched what I was going to say, actually. Yeah. And thank you for going to do your service, I would say, to your people, to our people. Yes. God bless you and God keep you as you go, and you will be granted journey mercies in the mighty name of Jesus. Amen. Now, Dr. Ajagbe, thank you, sir. Before Dr. Booker spoke, you took us through, I don't know, I'm not sure if somebody asked the question about gum being sensitive and then being inflamed. And then under the dentist, maybe they went to clean their teeth, and they had, what do you call it? They numb it, just so that the dentist will be able to clean and all that. So that person really sounded like me. And this was 2 years ago, I would say. And so that was when my dentist now recommended me to start using hydrogen peroxide, and she said to dilute it like you mentioned, half and half, but then mine was just a little bit, and then I'll dilute it and I will rinse out, and then after brushing, every night. As a matter of fact, she told me that I can mix it up with this mouthwash. I don't know what the name is again, but Listerine, it's that type that is gold, the gold type. So that's the one that I would mix it with and then go to bed. But then when you mentioned adding hydrogen, what is it called? Baking soda last week, Monday. Oh my gosh. Then I when I went to bed, before I went to bed, I did that. Boy, oh boy, Dr. Ajagbe, it was like, this really was what the doctor really truly ordered, because not only did my teeth, I feel like it's very clean. And the abrasiveness, like you were describing, because it's just there for a little while and it sort of coats all the mess that may have gone through even the crevices. I don't know if that's crevices, the corners and everything, inside the teeth before it turns into water, just like you will do salt. So I really truly enjoyed it. I look forward to doing it every night. But then I think it was 3 days ago, I said, let me do it in the morning. So I did it in the morning. Then I was afraid that maybe my breath will be stinking or something. Then I used a little bit of toothpaste, on my brush because I was thinking I needed that fresh breath. Maybe, but maybe I really didn't need it, but I just wanted to say that you enriched our knowledge of oral health, and may God bless you and continue to give you the wisdom that you deal with us in Jesus' name. Thank you. And thank you, Dr. O. Thank you, everybody.
Thank you. You're welcome. Thank you. I enjoyed your sharing. Thank you. Madam VP is clapping for you all the way from California. And Dr. Ajagbe, Dr. Ajagbe, let me tie this in because you're going to be able to address them together. Just 1 second. Dr. Akitonde said, Dr. Ajagbe delivers brilliantly all the time.
Yes.
He's just provided a solution to a dental problem that has tormented me and my bank account for years. Thank you, sir. Now I have 2 boxes of baking soda, including one in my car. That's why I said you have to tie this together. He has one in his car. I want the explanation for what
my Lord.
in the car. So the floor is yours, sir.
Okay. Well, Mrs. Akishola, I mean, this is incredible.
Yes.
Anyway, if I want to remind you again, I mentioned it several times. Baking soda and hydrogen peroxide will give you a fresh breath all day long. In fact,
okay.
you just killed it by putting your toothpaste on top. So if you did, okay, because see, if you do the baking soda first, and then you rinse with hydrogen peroxide, it will actually interact with the baking soda in your mouth already. Foam, and then it will go into every part of your mouth to cleanse out all those bacteria that actually hate oxygen. Those are the ones that we call, P. gingivalis. The P. gingivalis is the one that actually is the culprit for the bad breath. So if you're able to prevent that from spreading between the time you brushed in the morning and when you are having your lunch, you see, your breath will be fresh. Even if you ate pastries along the way, it would not be as bad as if you didn't use baking soda and hydrogen peroxide to brush. So just use it in the night. Use it during the day. In fact, you should use it during the day more than during the night.
She graduated. She said she used it in the morning.
Yeah,
so she moved up in the world.
He did excellently well, but you killed it with the toothpaste you added.
I know.
All right. So thank you for the other comment about 2 boxes of baking soda.
Yes, Dr. Akitonde. So now you solved this. Look, this is something that has tormented him for years, and his bank account. He's not just.
Well, I can tell you that he's not the first person. You will not believe a patient. Well, the person was not even my patient. I think we used to go to the same church, and then we were talking after service, and then the husband just mentioned to me, my wife, went to the dentist and this and that, and they've not been able to help her. And they came to me and said, where's your office? So I told them where my office was. They came, and then I looked at the lady's situation, it was bad. So I said, okay, you have tried everything everybody has told you. Have you ever tried this? And she said, what? You mean baking soda? I said, yeah, baking soda. She said, no, why should I do that? I said, okay. I said, have you heard about hydrogen peroxide before? She said, yeah. What does that have to do with my mouth? I said, okay, now we're gonna do something. If I said, I want you to humor me. Just get your baking soda that you've kept, even the one you inside your refrigerator. Just take a little scoop from that and get hydrogen peroxide and try this for 2 weeks. And then get back to me. The same thing that Dr. Akintonde just shared was exactly what she said to me. She said, where in the world have you been? He said, what in the world? Said, why nobody told me about this stuff? I said, well, most dentists will not talk about it because it's not on their radar. Because they believe Colgate is doing a great job, Crest is doing a great job. Why do you change it? If it's not broken, don't fix it. But as far as I was concerned, I did the research. It was part of my research protocol to look at some of these things that people use regularly. How effective is it? Does it really have effect? Does it have side effects? And so when I discovered that there were some things that I couldn't personally accept to use, I moved on to baking soda. So Dr. Akintonde, kudos to you. I'm sure that your pocketbook is saying thank you too. That you didn't have to spend so much more money on those big devices. You know how many people spend over thousands of dollars during Christmas to buy Sonicare from their dentist to give as gifts, thinking that they're helping their relatives, their loved ones with good stuff to clean. Well, some people might be doing it because the bad breath is killing them. So they just to be proactive, showing, like maybe if I gave this person the most expensive toothbrush, he would control the bad breath. But unfortunately, no. If you don't use those things very well, properly, well, you're still going to have problems. And then if you use it with the wrong dentifrices, which is like toothpaste that we're talking about, you're still going to cause problems. So why don't you make everything simple? Get just a cheap toothbrush, whatever, get it from dollar store if you may. As long as it's working, you know you are cleaning plaque. You're not cleaning the dirty black pot. You're cleaning your teeth. So be gentle with it and then use the tools very effectively and you'll be okay.
So I still don't know. I still don't understand the two boxes, the one in the car, but it's all good. I just want to say, don't buy the hard toothbrushes. The soft is actually better. Sister Kamsin, you have your hand raised. Kindly unmute. There, unmute.
Oh, okay.
There you go.
Good evening, everybody. Thank you.
Good evening. Hi, Scali. Hi, California. How's the weather?
Thank you, Dr. O, for the platform. And Dr. Ajagbe Esho, thank you so much for the information provided. My question is, and I don't know whether you've answered this or addressed this before, why are some people more prone to cavities than others?
Okay. The two possibilities. Well, let me just say two common possibilities. One is when their teeth were forming, they did not have enough calcium. So their teeth were not well formed. So if you look at some of those teeth, they have very rough surfaces. They have pits and crevices that can accumulate, plaque. And once plaque stays for more than 2 days, it becomes adherent, which means it's difficult to just brush off. So you have to brush it harder for you to remove it. The longer it stays there, the more plaque will form later on. So for those people that their teeth were not well formed, during, before they came into the mouth, definitely they will have more propensity to develop cavity. Now, that's one. Let's say your teeth were well formed. You have enough calcium in it. There was no roughness on your tooth surfaces, but you love to eat candy. You love to eat chocolate. You love to eat cookies. You love to eat brownies. You love to eat fudge. You love to eat all those sticky stuff, but you don't like to brush. Oh yeah, strep mutans is very happy in that environment, and they will multiply, multiply, and multiply. And they release acid. The acid they release is what actually destroys the teeth. The bacteria themselves don't destroy the teeth by eating up the tooth structure, but they release acid that dissolves the calcium away from the tooth surface, and that's how the people become more, exposed to developing caries. Now, if your teeth are well formed, but they did not have the structure of calcium crystals deposited in your teeth were deficient, even though the teeth was smooth, yes, you could also have propensity to develop cavity from the acid dissolution. I mentioned some time ago about those that are people from the eastern part of Africa that have very high concentration of fluoride in their well water and stream water, and they develop the kind of situation in their teeth that is a form of discoloration. So if you see some from East Africa, their teeth are usually like brownish to almost having pinkish hue. Some may have gray combined with different colors, but not white. That is because they have what we call fluorosis. Fluorosis is excessive calcium deposition in the teeth when it was being formed. Although it may not be attractive, but it's actually resistant to cavity. Most of the people from East Africa, when they develop, it's not that they can never get cavity, but they don't have frequency of cavity formation as those people who do not have the same amount of fluoride in their drinking water. So if you are raising a child who is very young, it is advisable when they are forming their teeth to at least add a little bit of fluoride to their whatever it is that they are eating. Don't give them excessive, because it's the excess that is the problem. The fluoride itself, if it's incorporated in the bone as well as in the tooth structures, will not cause any problem. They will actually protect those hard tissues.
Thank you so much.
Thank you so much. Thanks for the extensive explanation. Appreciate it.
You're very welcome.
Thank you. Dr. Ajibade, kindly unmute and ask your question. Kindly unmute. Dr. Ajibade. Sister Rosemary, you can unmute and ask your question. Thank you. Dr. Ajibade, get ready. Sister Rosemary, go ahead.
Can you hear me? Good evening.
Yes, good evening.
Good evening, everyone. Good evening, Dr. Ajagbe. Thank you so much for the information you've been giving us all these months. May the Lord bless you abundantly in Jesus' name. Thank you, because I called you a while ago to complain about toothache, and you told me to be using baking soda and peroxide, and it is working very, very well. I actually went to see my dentist the other day, and because you told me to bring my the x-rays and everything, and I told my dentist He's upset, because he wanted to do some other stuff and I just refused. He wanted to remove my teeth. And I don't think my teeth, I need to remove my teeth anyway. So I don't need him anymore. He refused to give me the x-rays. I don't know what he's trying to do with my x-rays though. So I don't understand a bit. I'm doing very, very, very well right now. Thank you so much. And I appreciate it.
You're very welcome. Let me just, for the sake of other people who might have their records with a dentist, it is your right to request a copy of your dentist. So my advice to you is to request for it. Don't demand for it. Just request normally. Let it not be like a contention. They may charge you some fees, but they cannot tell you will not get your record. In fact, it is your right. So you should be able to request for it. I'll type my phone number in the chat. So for anyone who wants to reach out to me, if they have personal issues to talk about, I'll be glad to talk to them as members of Medical Mondays. So I'll take a few moments.
Thank you, Dr. Ajagbe.
Thank you, Dr.
I just texted you for that. So while you're doing that, Brother Chris, all the way from Nigeria, go ahead, ask your question, please.
Thank you very much, Dr. O. It's always a pleasure to see you and hear your voice and see the family here.
Thank you.
Our top gun, Professor Ajagbe, this is my first time feeling him actually talking to us. And his hydrogen peroxide and what do you call it, baking soda have gone viral, I must tell you. And we're all seeing the effects right now. And I must say that that's, glory to God, credit to medical medical Mondays with Dr. O. People now understand that there are easier, in fact, cheaper ways and stronger, sustainable ways to keep your teeth healthy. And I must thank you and appreciate you for that. Dr. Ajagbe, thank you very much. God bless you. And I'm almost really tempted to ask you because you seem to be an authority on every medical field, every medical area. I don't know. I mean, are you a general? I don't know how to answer that question. Why are you so robust medically? That's what I wanted to know. Thank you very much. And you're looking sweet as usual.
Thank you so much, Brother Chris. I really appreciate your comment and feedback. Well, that's what I said earlier on, that over time, the simplicity of what is being shared here will catch on. But I have to add something, a caution to situation in Nigeria. Please, if you're going to buy any of those products in Nigeria, be very careful. I'm talking in terms of the kind of product that you can get can be very dangerous because sometimes they don't even know the right content that's in the bottle. This last time I went for Dr. O's mom's funeral, I went to 3 different places to try to look for hydrogen peroxide. And there's only one place that has something close enough to what is hydrogen peroxide. So it is very dangerous, even though I shared it, that in Nigeria, it's like all bets are off. If I didn't see it by myself, I would say, oh no, that's exaggeration. But it was bad news because 2 of them were just water, nothing else. Water in the bottle, no hydrogen peroxide, nothing.
Then the question, sir, Ben, is because what you said is really groundbreaking and it's scary, it's dangerous. And because a lot of people who, at least those people I told, who are quite excited about the mix, the solution, are going to go into these places and they're going to go looking for hydrogen peroxide. And from what you're saying,
Yeah,
the majority of them are fake.
that is
How do
what
you
that.
recognize the original one? How do you
Well,
do that?
and that's why I am sharing it right now openly, that all bets are off in Nigeria. I don't know where they get their products from. I don't know what NAFDAC is doing. I don't know who is there to be like a consumer advocate. I don't know. These are some of the things I would like to do, this consumer advocate, checking these things to be sure that what they promise is what is inside it. Because
My
it is.
question again, sir.
Huh?
My question again, then, sir. Because this thing that you just said, thank God, we spoke out just now. A lot of people are busy buying the hydrogen peroxide now. So obviously they are buying fake. Well, it's bad enough that they are buying fake. It may become injurious to them. So we need to help those people right now, doctor. So
Okay,
what
Chris,
we do, Sama?
Chris, your question specifically, you said, how would you identify fake? Dr. Ajagbe
Yes.
had just shared with us, this is scary, that
Yes.
places he went to, it was just water. Hydrogen peroxide foams.
Okay.
Let me just
It
address
foams.
that.
So to answer your question, it would foam. If it's water, it will not, water will not foam. You see what I'm saying? So that's I think that's a critical way to recognize if it is.
They might put detergent inside, so be very careful.
No, it's not. It's Rosemary, don't spoil our mood.
Okay, let me address.
Oh my God.
Let me address so we will not get sidetracked by some things else. The hydrogen peroxide, I think the problem is they do not know the chemistry, because they believe anything that doesn't taste like water should probably be and it's clear, it's colorless and clear, can pass as hydrogen peroxide. Once they put it in a brown bottle, and oh my goodness, I think everybody should be happy. No, if I didn't try it, I would not know this. One of them contains some form of acid. And that is how dangerous. That's why I'm saying it here, so that nobody will say to me, oh, you said I should go and buy hydrogen peroxide, or somebody told me about you telling us about hydrogen peroxide. If you don't find the right hydrogen peroxide, don't use it. Please just use baking soda. And then also baking soda. All right. I want to tell you again, it's fake. You can find a lot of fake baking soda in Nigeria. Okay. I asked somebody to buy me baking soda. They brought it to me. It's more like using wheat flour. I mean, just like the white flour for baking bread.
Yeah.
And maybe a little bit of salt in it.
Jesus.
And it was all that they had for me as baking soda. And I'm like, if I didn't know what baking soda was, oh yeah, I'll be using it. I'll be saying, oh yeah, thank you for getting me baking soda. But I said, oh my gosh, what in the world? Why would people do stuff like this? If you don't have the product, don't sell it. Don't say because people are going to buy it, just start selling things that are not right. But anyway, I just need to put that out there so nobody will start quoting me and saying something.
Okay, Chris, again, to answer your question directly, to identify hydrogen peroxide, to know that this is authentic. And, Dr. Ajagbe is right on the money that there are lots of fakes in Nigeria. But we do know, that what pharmacies to go to, that they're not fakes, where you get the authentic stuff. There are pharmacies on almost every corner, but you don't want to go there because the tendency to get fakes will be there. But for baking soda, again, Dr. Ajay just posted, it foams. and the volume of the foam increases. See, when you swashing in your mouth, it's like when you squat a little bit in your mouth, it's like the thing gets fuller and fuller. Like, the foam keeps, increasing, that you want to spit it out. That is authentic. Baking soda, like Dr. Ajagbe said, I don't even know how to advise on that, to identify.
Okay.
But
So
I would suggest,
avoid,
just a minute, please, Dr. Ajagbe. Just a minute, please. Dr. Ajagbe, just a minute, please, sir. I would suggest, though, that you go to those places that sell the authentic stuff than, the pharmacists on.
Can I make a suggestion?
Okay. Go ahead.
I think this is a national, of national interest to Nigeria. This is one thing we're saying now, but it's bigger than it is, than we think it is. I am suggesting that Medical Mondays will do a press release on this for Nigerians to beware of fake hydrogen peroxide and baking soda. And well, I'm not the expert, but when you give me the the details of what to be to look out for, I will now have to give it the journalistic what have you. So now make it a press release, formal press release by Medical Mondays to Nigeria. Yeah, I think that's needed. That's urgent.
We'll do it. We'll do it. We'll chat after the program. We'll do it.
Yes.
And
yes.
my deal is also to just educate the public on how to identify the real thing. Dr. Ajagbe knows hydrogen peroxide and knows the difference between water and hydrogen peroxide. How many people do? How many people do? We know, I know the difference. How many people do? And you're right on the money, Chris. We'll do that. We'll get it done. Okay? We'll do the press release. Dr. Ajagbe, you were going to say something, sir.
Well, I was just going to say that sometimes they sell what they call baking powder in Nigeria for baking soda.
Okay.
So there are two different things. The baking powder is different from baking soda. All right. And the concentration of sodium bicarbonate that actually is the active ingredient in baking soda is higher in baking soda than in baking powder. There's still a little bit of baking soda in baking powder. That is this. So all I'm trying to say is let's be vigilant and be aware there could be more danger in switching when you are using the wrong product.
Because a lot of people are going to be mixing up baking powder with baking soda.
Sorry?
Well,
yeah, a lot of Nigerians are already going to be mixing up baking powder with baking soda.
Okay. Oh, wow. So it's important to educate our people on that. It is true. There's a difference. There's a big difference. But Dr. Ajagbe, I guess we'll chat later to even know how to describe, recognizing authentic baking soda. So Dr. Okweyemi said the advent of fake products in Nigeria is very horrible, not only on hydrogen peroxides. The public don't know differences between them. That's true. I think the press conference will help, at least to start saying something. Like Dr. Ajagbe said, we are regulatory bodies. So maybe they don't know. Maybe that would help them to know that there's a problem and step up their game. What do you think, Dr. Ajagbe?
Well, I think from my own observation, I've been going back and forth to Nigeria for a while now. So at least I have very good, keen observation about how some of this market stuff works. One of the things is that you don't even know that some of these so-called manufacturers exist. So they're not visible. So you can't even go to their, place to say, you want to enforce any regulation. So somebody doing it in their backyard, and just once they find the bottle, they put labels on it, they carry it on the buses, they're selling their products. Nobody stops them. Nobody tells them where they get their products from. It's difficult. I mean, I'm not saying it's impossible. If NAFDAC cannot enforce, then there's going to be a problem. Manufacturers have to be truly identified, because the standard operating procedure must be what they use to produce every lot must be the same. I mean, must come out the same way in the end. But if there's no way to monitor that, it's going to be tough. That is in Nigeria. But I know that there's some pharmacies, like Dr. O said, that are selling very good ones. I know I've bought some in VGC about 3-4 years ago. That was very good, because I wanted to test whether I could even find any hydrogen peroxide in Nigeria. And I found in one of the pharmacies in VGC, and it was good. And I was very impressed. It was very small bottle, but nonetheless, it was actually hydrogen peroxide.
Yes, suggest something. Yes. Can you hear me, sir?
Yes.
Your voice is very low, though.
Yeah,
Oh,
go
sorry,
ahead.
can you hear
I'll
me
try.
better? Now,
Yes.
the
Yeah, we
thing
can hear
is
you
this.
better now.
Yes, I'm sorry to scare also with this what I'm going to say. Unfortunately, when Dora died, NAFDAC died. Okay, I don't know whether you remember the late Dr. Dora.
Yes, we remember her. You said when she died, NAFDAC died. Is that what you said? Okay.
Yes, that's what I mean. So right now, the consumers are on their own. And it's this platform such as this that helps them to have informed decisions, on products like this that could save their lives. So fortunately for Medical Mondays, well, and unfortunately for NAFDAC, you are now, well, God may have provided a position for you to fill that vacuum in the best way you can to help Nigerians. I can assure you, for instance, baking soda, baking powder, hydrogen peroxide thing, once it's out there, you will be shocked at the response by thousands, if not millions of Nigerians, because you will have helped a lot of them. Nigerians are helpless right now as we speak, not only on the political front, on so many fronts. Their health is in peril, it's in danger right now, jeopardy as we speak. So Medical Mondays, I'm calling on you to kind of fill that gap. If needed, it's urgent, it's urgent, highly. Thank you.
Thank you. Appreciate you. We'll do the needful. Okay, we'll do the needful. Any other questions? I want to also remind us that on this platform, we are not establishing care. We are disseminating correct, cogent medical information to prevent and sometimes even to assist in, taking care of issues that are already existing, but we are not establishing care. Dr. Ajagbe has posted his number and it's available. I can tell you, one of the best we have. We have resources in Nigeria. I mean, it's just amazing. Even on Nigerian soil, our doctors in Nigeria are top notch. Overseas, the same thing. And Dr. Ajagbe is one of the best of the best. He has made himself available to us on Medical Mondays, that if you have any issues, contact him as a Medical Monday family. So you can do that. I'm looking for his number again to repost and I couldn't find it. it's best to get him on WhatsApp. And I also wanted to say that you should please, please, please take some minutes to subscribe to Medical Mondays with Dr. O on YouTube and like us. Please spread the word. Get on YouTube and let's do it. Thank you. Look, Dr. Ajay is too much. Always getting my behind. There, that's Dr. Ajagbe's information. And sir, thank you so much for another fabulous night. After last week, I'm like, no, we can't leave the microbiomes like this. And with the experience that I had, near-death experience that you witnessed and my husband, both of you men became jelly. I saw it. I was laughing at both of you, even though I was in a bad shape. You became jelly, both of you. Scared to death. I remember that and I thought, no, we need to address this issue. Just baking soda and hydrogen peroxide could have prevented me from all of that. Come on, we can do this. It's simple enough. So Dr. Ajagbe, I'm gonna yield to you to give us some parting words, sir.
All right. Thank you all for your attention and patience. You know, it's kind of like opening a can of worms. There's so much in there that we need to address. But the key issue that we were addressing today was the identification of two very dangerous microorganisms that not just wreak havoc in the mouth, but they wreak havoc in the body as a whole. And we, kind of use at least 4 systems to epitomize the danger of these microorganisms. So now that we know what they are and what they could cause, we know what can be done to prevent them from getting overgrown or to overgrow in the mouth, then at least we're having a little bit of solution. If there are diseases that have been caused by these microorganisms, they still also can be, treated. If you want to screen an individual or you want to get screened by yourself, there are resources to do that. So for people who will say that they've done everything, but their bad breath keeps on getting worse, then it means you need to get somebody's attention who can be of help to you. Don't do it by yourself any longer, since you are not getting much headway in that direction. So probiotics for the mouth is important, and they are new. They're just been introduced into the market. So, it's going to be pretty much like try and error. If you try one and it helps you a whole lot, then you might stick with that, pretty much becoming a brand loyalist. Whatever way you can do to make your oral health and systemic health to be, in tip-top shape, I think it's your prerogative and it's your right to do that. So if there's any need for further explanation on any of these things and you want to do personal, discussion, I'll be glad to talk to you. You have my phone number. And I think there are 2 other topics that we might be able to delve into in the future when the opportunity presents itself. And maybe Dr. O, you want to mention those 3 topics quickly?
No, you can go ahead and do it. You're doing a great job.
All right. So the next topic is the connection between mouth breathing, obstructive sleep apnea, gastroesophageal reflux disease, which is the same thing as GERD, and bruxism. Most people don't see the connection between these, but they are very closely connected. So we will be able to review that at another date. The next one is bad breath. So we're going to focus a whole, session on bad breath, understanding and managing bad breath. And then the third one was suggested to the urologist, that is the prostate health, BPH, and cancer prevention. So hopefully we'll be able to cover those topics, very soon, so that people can begin to enjoy their overall, well-being and health. Thank you very much for your attention.
Thank you so much, sir. And when we having that topic, BPH and cancer, women, you have to come.
Yes.
Because the source is the same. The men have been showing up for menses, so and they gained. So we too have to show up for the BPH and cancer. And what I found out from the naturopaths is that the source of these cancer things are the same. Talking of that, Dr. Ajagbe mentioned going back to the natural things to take care of ourselves. Next week, we are going to have an amazing session again with Dr. Mike Oye. I found out about a plant that I was like, what on earth is this? Found out the scientific name and everything, and it blew my mind. So I texted him, and this was a while back, and he said, it told me so much about it, and said, you know what, let's talk about this. But it's not just the plant, it's a lot of things, so that we can see things in our environment that we can actually utilize to improve health. As Dr. Ajagbe mentioned, he mentioned that briefly. So thank you so much, everyone. And thank you, Dr. Ajagbe, for another amazing session. And I want to also say thank you for mentioning, sipping the warm water in between meals through the day. I am glad that we have gone mask off in clinic finally. And I'm able to sip again. The last few years has been interesting because we couldn't drink. We were masked up, and for hours, you have your mask on your face all through the day and can't drink. But thank God the mask is down, but please still stay safe. I'm still diagnosing COVID. I diagnosed 4 in 1 week. So let's still be careful in closed places or enclosures where there are lots of people in a small area, or where people are coughing. It could be COVID. So let's be safe. Thank you. Have a blessed night, everyone.